Because we get patients that are coming and interested to find out what proton therapy is. And so we found this is a good way to help level set and tell people generally what it is that we do here, and then some of the more common cases that we see, as well as followed by a tour of the facility, because we have patients who are getting treatment or are going to start treatment that are wanting to see what the facility looks like and show their family members what they're going through as well as the treatment. All right. Our tour is usually right about 11:15 or so, and so I'll be happy to answer questions as we go, but I might say, you know what, let's hold the questions to the end, because if we're getting close to that time, I might say, let's get that done, otherwise the therapists get mad if I interrupt their schedules, and so I don't want that. But I'll be around afterwards, I can answer some questions then as well. Okay. So, as a very high level, I tell patients proton therapy is a form of radiation therapy. And radiation therapy in the United States is primarily used to treat cancer of some type. And so most of our patients have some sort of tumor. Cancer itself is a very old diagnosis. It actually comes from a very old word, because cancer is something that affects a lot of people. It's estimated that 1 in every 2 women, or 1 in every 2 men, and 1 in every 3 women in America will get cancer at some point in their life. And radiotherapy is used in about half the patients for the treatment. But the history of cancer goes back a long time, such that the word of itself is actually a very old word. We use the word cancer in another way in the English language outside of medicine. Anybody else knows how we use the word cancer outside of medicine? Anybody who likes stars or? It's an astrology, that's right. There's a sign, cancer sign, right? You got like Gemini and Sagittarius, Leo. Cancer is one of them. And do you know what the shape of that constellation is?
Crab.
Crab, that's exactly right. That's because the word cancer is the Latin word meaning crab. And the reason for that is thousands of years ago, when people were dying of what we call cancer now, those early physicians would do what we would call an autopsy, and they would find these masses that are growing inside with little legs that went beyond the area that looked like little crabs to them. And so they called it the same thing, a cancer, a crab there. And here is actually an image of a breast cancer specimen. You see the white there. Uh-oh. My pen just froze up. Okay, I'll read this real quick. But you see this white thing? That is the cancer itself growing in the middle of the breast specimen. Of what's called X-rays. It's part of what we call the electromagnetic spectrum. The way I describe it is, if you think about the rainbow like this, we all learn about that as kids, right? On the far side of the red, we have infrared rays, radar, radio waves, and so forth. But it's on the other side of the purple. It's where you get the high energy stuff. Ultraviolet rays, X-rays, gamma rays. It's this stuff that has enough energy to damage the DNA and kill off the cancer cells. And when we give radiation to a patient, I have to remember that this radiation is getting absorbed as it goes through the body. Okay? Because most radiation uses this X-ray radiation, kind of the standard radiation. So what I describe is, if you think about, you're standing over here in La Jolla at the pier, looking to the ocean. If you look down, as it gets deeper and deeper, it gets darker and darker, because that water is absorbing that light energy. If you were to try to graph that out with the depth of the water and the amount or the dose of the radiation, what you see is something like this. Less and less radiation as it goes in, because the body is absorbing that energy. Now, most humans are about 70% water, so our bodies absorb radiation very similarly. And I have to remember this fall off as I'm giving radiation to a patient. So the example I'm going to use is the most common cancer among men in the United States is something called prostate cancer. Okay. The prostate is a gland that sits in the middle of the pelvis right here. Okay. If you do a slice of me right through here, the prostate sits in the middle. And so if you're imagining this picture, slice of me through the middle of my pelvis, this is the prostate in the middle. In front and on top is the bladder, and behind it is the rectum. And I tell people, I'm not an artist, you kind of use your imagination as we talk for this. Okay? If I'm trying to give a total amount of 80 units or 80 gray of radiation to this prostate gland, knowing this radiation falls off, if I were to come in from one beam from the front, I would have to give about 120 units from the front. That bladder would get about 100, that prostate would get to 80, and the rectum would get 60 before the radiation passes through. We say, okay, this is one way to get the radiation there, but it's a lot of radiation still to normal tissues. Even though the normal tissues are more resistant, we said, can we use some geometry to reduce that? So we said, great, what if we did two beams, giving 60 from the front, the bladder would get 50, prostate would get 40, that rectum would get about 30, and the radiation passes through, and then I can come in from a beam from the side, like this, giving 60 there, the skin, 50 at the hip, another 40 there at the prostate, and then 30 as it passes out. And now where these two beams meet, it still gets that total 80, right where I wanted to go. But every normal tissue's dropped by half. People said, great, what if we did this? 35 from the front, 35 from the side, and then come in at an angle like this. I could do 35 that way. Again, where all those beams meet, it still gets the total amount of radiation, but any one normal structure gets less. So here are some examples of that. If a slice of a CT scan of a patient with prostate cancer, this is a patient I treated about 20 years ago, and this is the prostate in red there, the bladder in front in yellow, and the front of the rectum in green. If I did one beam, it would look something like that. Two beams would start to spread that radiation dose around. Three beams would look something like this. And if I were hypothetically to do 8 beams, it would look something like this, where the radiation really is just focused around the target, that prostate, and any one normal structure gets less radiation. So most radiation in the world does something like this, multiple angles using X-ray radiation, and there's a lot of different names for it, IMRT, CyberKnife, Gamma Knife. And so machines look like this because of that reason. A patient laying on a table, okay, this table goes in and out, left and right, up and down. There's also a cutout of the floor so the table can rotate. And the head of the machine that gives the radiation comes there, and this rotates around 360 degrees. And so by using a combination of moving the machine and moving the table, I can come and give the radiation beams from any angle, depending if I'm treating like breast cancer, or if I'm treating a uterine cancer, or a brain tumor, or head and neck cancer. I can come in from a variety of directions to just specifically treat one area of the body and avoid the normal tissues that I otherwise don't want to treat.
Is this radiation therapy or
electromagnetic spectrum, like the rainbow? Protons are a particle. They have mass to it. Okay, and because of that, it has some very unique characteristics. It can slow down, it can speed up, and very importantly, it can stop. And so if you imagine that, again, looking down into that depth of water, and if we were to graph that out again with the depth of the water and the dose of radiation, again, standard X-ray radiation is something like this. What we found with particles and protons, for instance, is there's actually less radiation on the way in, and this begins to slow down, more and more radiation, before it gives a peak of energy, depositing all the rest of the energy, and no radiation beyond that. And this peak is called the Bragg peak, and that's one of the unique characteristics about proton therapy. That's why it's a lot of logos, like our California Protons logo, it's got that peak that ends in San Diego. It's after this Bragg peak. And so it allows us to do some unique things. For instance, if we got that same patient with prostate cancer, middle, the bladder in front on top and the rectum behind, we come in with one beam like this, giving maybe 25 units on the way in, 40 units, and the radiation stops. Likewise, with the same from the other side, 25 units on the way in, and 40 units, stopping. And so if we were to look at that exact same patient with the proton radiation instead, again, the prostate's in red, bladder's in yellow, and the rectum is in green, you can see this low energy or low dose radiation on the way in, high dose is right where I want it, and then the radiation stops, proton stops. Coming from the other angle, and that allows us to do something like this. We're still able to get the same amount of radiation to the target, but less radiation to the normal tissues. And so if we were to compare those from the X-rays versus the protons, you can see the main difference is avoiding the normal tissues there. And this is helpful because although the normal tissues are more resistant to radiation, what we know is the risk of a side effect is directly related to how much radiation that tissue gets. Right? So when I'm treating a patient with prostate cancer, the most common side effects are urinary irritation, where the patient has to get up to pee more often, like burning on urination and so forth, or rectal irritation, because those organs are right there, like rectal bleeding and rectal irritation. If you can lower the amount of radiation to the bladder, lower the amount of radiation to the rectum, there's less of a risk of that occurring. And in some cases, if you can eliminate the radiation there, then there's no risk of side effect occurring there. And so one of the goals of proton radiation is, can we get the same amount of radiation to the tumor for cure, but lower the amount of radiation that would cause potential side effects? In medicine, generally, the last 4 decades, we've gotten better and better at diagnosing cancers. We got a lot of different screenings, right? Mammograms, PSAs, colonoscopies, and so forth. And in doing so, we find cancers earlier and earlier. And that allows us to treat cancer better and better. And so the goal of cancer treatment now has moved from just cure at any cost to curing patients with the least amount of side effects. Right? We moved from doing mastectomies to all women with breast cancer to smaller surgery. It's the same cure, but less side effects. And the protons is kind of the next step in that same philosophy. 5 or 10 minutes to move to a third angle, and then 45 or 60 seconds for the treatment itself. And so when we built one of these machines originally, we didn't want a very expensive machine sitting there 25 out of every 30 minutes. And so by having multiple rooms, that allows us to treat one patient in one room, getting another patient ready, another patient off the table, another patient waiting for the machine, and so that we can maximize the efficiency of our accelerator. That allows us to treat a lot more patients. If I only had one room here, I'd only be able to treat about 30 or 35 patients a day. Here we can treat 100 patients a day. And even with that, we have a waiting list because it's just, we don't have capacity to treat patients. And so there still could be more for protons